Hi, welcome to the Fit and Healthy Today show, and today we are going to discuss a subject near and dear to my dad, gout. 90% of the people that suffer from gout are men, and they tend to be men 40 years old and above. When we talk about what gout is, it's a form of arthritis that's caused by excessive uric acid produced by the kidneys. It gets in the blood, the tissues, the urine, and makes the body very, very acidic. What occurs then is calcium crystals kind of bind to neutralize this acidity, and these calcium crystals then will solidify in the areas where the body temperature is the lowest, which in most cases, once again 90% of the cases, is the big toe. And if you've ever seen guys limping around like this and they'll ask, how are you doing? It's like, yeah, I'm fine. Are your arthritis bothering you? They'll say, no, it's probably gout. What happens, a lot of it has to do with an inadequate amount of a certain type of digestive enzyme that helps break down uric acid. And once again, diet being a contributing factor, heredity being a contributing factor, and the acidity or acidic pH of the body and the ability of the body to try and neutralize those pH levels by pulling the calcium out of the bones, and boom, you end up with those calcium crystals forming. Symptoms: sharp pain in a single joint area, as we mentioned before, in the big toe. It can also appear in the ankles, the toe joints, sometimes in the hands, but most of the time it's in the lower extremities. And they get very hot, sensitive to the touch, very, very painful because you've got these little calcium crystals slicing and dicing on your tissues. So every time you move, it hurts. So looking at the causes, I briefly touched upon that a minute or so ago, but a diet that's rich in poor quality proteins. So if you've got a person that's the burger and steak king with the potato sitting beside it, you've got lots of acids and very poor quality protein. You're lucky if a good steak has a 35% biologically available protein. So you've got all this excessive protein raising the uric acid levels, and hence when you raise the uric acid levels, you get gout. What's interesting, blood sugars also, or people who have higher blood sugars or eat a lot of sugar foods, pastas, starches, things that raise the blood sugars, will make the body very acidic as well, and the body will pull out of the bones again the calcium to neutralize the pH. Because in human beings, the pH in the blood needs to remain right about 7.35, which is slightly alkali. Sorry for the science, but I want you to kind of understand. Obesity, high blood pressure. Poor circulation, obviously, with high blood pressure. Obesity, you've got more vascular system to feed, so you get poor circulation. Kidney disease, or people who have kidney stones tend to also suffer from gout because, once again, the high uric acid levels form those stones in the kidneys and then in the poorest areas of circulation. Stress and acidic diets. Stress is the most acid-producing thing that you can put the body under that will acidify and cause gout, kidney stones, cancers, the list goes on. The body doesn't like an acidic diet or acidity, period. Once again, it likes that 7.35 neutral or above slightly alkali pH. There's other factors too that can contribute to gout that we sometimes don't think about, and that's heavy metal I'm going to say the word right, heavy metal toxicity, particularly lead. The body's dealing with that, fighting with that all the time, and it's in a continual inflamed state. Inflammation makes for more acidity. Dehydration, particularly if you're on pharmaceutical types of diuretics or high blood pressure, hydrochloride, tend to wash the minerals out. They tend to raise the uric acid levels. There are also other medications which I know most people are going to go, oh, that contributes to gout or to my uric acid levels. Aspirin, the good old aspirin therapy. High dosages of niacin that a lot of doctors are putting their patients on for cholesterol. Antibiotics, which make the body very acidic, destroying the good bacteria and disrupting what we call homeostasis of the body. And then, of course, chemotherapy or any kind of traumatic surgery or traumatic types of treatments that the body undergoes that will make it just off balance can bring on gout. We see a lot of gout with chemotherapy patients. I know most people think, chemotherapy gout. Yeah, I see it all the time in my stores. Since diet is one of the contributing factors towards gout, I'd like to examine what we can do about it and how to modify the diet. When you have a gout breakout, or if you have a propensity towards having gout all the time, you're going to avoid all meat, particularly red meat, pork, poor qualities of meat. Shellfish, peanuts, brewer's yeast, dried beans, cooked beans are okay, lentils, spinach, fried foods, white flour, pasta, starches. In other words, you're going to be doing a very clean diet of your fruits and vegetables with very good quality proteins that are going to be primarily plant-based, or fish such like as cod or halibut. They're anti-inflammatory when we eat them. And so if you combine the fruits and vegetables, a little bit of nuts for essential fatty acids, actually the kind of diet that you should be on from the beginning. And once again, if you're eating that high saturated fat, high not such good protein, a lot of sugar, you're on the way towards gout and high uric acid levels. The concern with uric acid also in these formation of these calcium stones throughout the body is if they're slicing and dicing in your toes, it's slicing and dicing in your vascular system and in your kidneys. We only got two. You can function with one. Kidney transplants are hard to come by. So if you have this issue, you need to get it resolved. We talk about medications that are available out there, and there's something called allopurinol. There's other medications, but it's the most popularly prescribed drug. That's a tongue twister. But it causes skin eruptions, blood vessel inflammation. The last thing you need to do when you have calcium deposits is to have vascular inflammation that can contribute to other things, including heart attacks and strokes, and liver toxicity. So looking towards other options, diet obviously, eating cherries, strawberries, blueberries. For some reason eating about a cup of cherries a day, and there is black cherry juice extracts or black cherry juice that you can do when cherries aren't in season. It lowers the uric acid levels, and I mean usually within about 24 hours you get some fairly immediate relief, particularly if you initiate the diet changes as well. Eating nuts, flax seeds, as I mentioned before, fruits and veggies, things to alkali the blood to lower the uric acid levels. And something I think most of us forget to do, and what I forgot to do a good portion of today, and I'm a little dehydrated, is drink lots and lots of water. I know it's really hard, we're busy at work, we're going and going and going, but drinking a lot of water keeps the kidneys flush, it keeps the pH neutral, because most good clean water is right about neutral pH. Supplements, we mentioned black cherry, celery seed extract, and actually celery itself can lower uric acid levels. You just got to eat massive quantities of it. But celery seed, we also know celery for blood pressure also and vasal health, but celery seed can be used as a treatment and a prevention, just like black cherries or black cherry juice. You can take those on a daily basis. Now obviously if you have blood sugar problems, you're going to do black cherry in the capsule forms so you're not getting all the sugars. Clean fish oil. Since we like to eat fish, I enjoy fish, but the problem is most of it is contaminated. We can get, Alaskan salmon sometimes of the year. We can get some good fish. But the problem is most of the time we can't. And that being the case, then you want to look for a real clean source of fish oil to reduce the inflammation. And once again, it's not just inflammation from gout, it's inflammation for other forms of arthritis and in your vascular system as well. Green drinks, you can juice, or you can buy the pre-powdered mix, or you can do green such as chlorella, chlorophyll. Those are all extremely oxygenating and alkaline on the blood. And when you oxygenate and you alkali, the pH comes down, uric acid levels go away. So if you got a juicer, pull it out of the cabinet, pull away all the dusty stuff and the cobwebs, pull out your juicer, and then start using some good detoxifying juices like celery. You got to avoid spinach when you have gout, but celery, you can do some carrots, you can throw in some cilantro for heavy metal detox, you can throw in some beets. All of these things help to alkali the blood. And it'll give you more energy too as you're fighting this painful thing. Bromelain. Bromelain is an anti-inflammatory. It comes from pineapple, and we use it a lot in arthritis, period. But it helps reduce inflammation. It also helps prevent the platelets from becoming sticky, so it can also be utilized if a person tends to have blood clotting issues. It's kind of funny because oftentimes when people have uric acid issues, they tend to have issues with their blood as well. That's why going on allopurinol is kind of like, it needs to be very, very well supervised by a physician. Quercetin. You know, quercetin is a bioflavonoid that I sell tons and tons of in the store for allergies, and it helps other things we've discussed. But it's also primarily an anti-inflammatory. And so quercetin is very helpful at prevention and as well when you get it to reduce inflammation. I know we talk about homeopathics, and I'm not a homeopathic doctor, but I have some knowledge about homeopathic medicine. And there are particular homeopathic medicines that can help with the pain of gout. And I list one down on here. You're going to do 4 of the pellets 3 to 4 times a day. There's a couple of companies that make this 30C concoction. But when you're in serious pain, every 2 hours. The homeopathics really do work, and they were one of the first medicines that the AMA had approved over 100 years ago. So very helpful, doesn't interfere with any other medications. So looking towards that for pain if you possibly can. Nettle root. Now, nettle lowers uric acid levels in the kidneys, which is also good for kidney stones. Also used for allergies. Very beneficial for a lot of other things. Most people that come in to my store will grab it for allergies. But reduction of inflammation, and you can take nettle on a daily basis. Applying cayenne cream, and you're thinking, I'm going to put cayenne, it's hot, on something that hurts. Believe it or not, cayenne has studies, and I know Ralph has mentioned before cayenne for pain in some of the studies that he's done in his research. Cayenne topical application increases circulation and helps kill pain. So very easy, relatively inexpensive thing that you can get from your health food store. Try, when I usually make recommendations, I usually tell people to try a few of these as best you can, but long-term, and I don't have this written down here, the long-term effects that you want to look with gout, and most people, and oftentimes physicians, take it extremely lightly. I don't, because when you have anything that's slicing and dicing on your tissues and in your vascular system and on your kidneys, and remember where your blood circulates throughout your heart, these calcium crystals can deposit on areas of inflammation, as a side note. So not only with gout, but in your heart valve areas. So keeping those levels of acidity down, keeping the pH for alkalinity high, gout, and a heck of a lot of other disorders. We're going to be moving on next to the fitness portion of our show. Thank you very much. Hi, welcome to the fitness portion of our show. And today we're going to be addressing the 5th chakra. Hey, that was a faux pas, a 5th chakra faux pas, which is your throat chakra. And when we talk about the throat chakra, there's certain things that come out when we're deficient or when we have too much in our throat chakra energies. Primarily, obviously, it's our communication and verbal creativity that comes through in our throat chakra. And when you're balanced, you're truthful, clear-spoken, reflective, creative, honest about your own weaknesses, independent, good communicator, and contented most of the time. Nobody's content all 100%. When you're unbalanced, you have poor communication. Sometimes you're very judgmental. You're dishonest. You lack creativity. You're arrogant, indecisive, dependent on other people, and very unfeeling. And those are throat chakra symptoms, I should say. There's quite a few good exercises that are available, some of which I get a little concerned with because it can affect your back, and some of which, if I stick my tongue out and cross my eyes, I don't want that on YouTube. So I'm going to show you a basic exercise that you can do anywhere, including at work, for your throat chakra, particularly if you feel like maybe you're Sometimes it happens with bosses or with our mates. They'll suppress what we feel is our ability to communicate how we feel or what we want or what our ideas are. So you can do this in the office when your boss blows off your ideas. What you do is you're going to inhale deeply. Now, mind you want to sit up. I'm not talking about throwing the shoulders back, but sit up somewhat straight in a very comfortable position with your legs out. And you can do the yoga position. I just like to just cross my legs. And then what you're going to do is you're going to take a deep breath. You're going to put your, so that I can talk to you, I'm not going to do too deep of a breath. You're going to lower your chin down. Mind you now, if you have certain upper vertebrae issues, you're not going to be able to do this. You're going to lower your chin down, and you're going to hold your breath for about 5 seconds. That was a joke, huh? 5 seconds. Then you're going to slowly release your breath and bring up your neck to a straight position. And you want to do that for about 3 to 4 repetitions. Whenever you feel the need and whenever you feel maybe that you've got issues with what's coming out of here, work on the throat chakra. Thank you very much. Next, we'll be moving on to the research portion of our show. Thanks. Hi, welcome to the research portion of our show, and with us today again, as appreciated, Ralph Turchiano.
And thank you for the intro. Well, let's start out with pregnancy and mortality. In an interesting article that came out of the Johns Hopkins Bloomberg School of Public Health, they had an article entitled "Mortality Rates Reduced Among Children Whose Mothers Received Iron and Folic Acid Supplements." Now, most of you already do that as a prenatal, but to reiterate how important it actually is, they followed children up to the age of 7. And this is what this simple prenatal supplement did in its impact on children's health. They said, quote unquote, "We found a 31% in childhood mortality due to maternal and postnatal supplementation with iron and folic acid compared to controls." A 31% reduction. That's pretty darn important and a good reason to stick with it. They also brought up the point by saying as many as 40% of women that are pregnant worldwide have anemia. Simple, cheap, real effective, real important. Outside of that, back to vitamin D. Well, they did another study, and this was done at the Children's Hospital in Boston by a very good doctor called Jonathan Mansbach. What they discovered was that most children, on average, looking at optimal levels of vitamin D, 75% were deficient in vitamin D. Very simple, very cheap. In fact, about as expensive as a typical milkshake. Not a bad idea to have your children on. And on top of that, if Hispanic or even black children are as high as 92% deficient in vitamin D. Basic, simple, they said, quote unquote, Mansbach recommendation that all children should be taking vitamin D supplements, especially those at higher altitudes. Considering what vitamin D does for coronary development, bone development, and everything else along those lines, such a simple thing. Not a bad idea. If you don't have your children on multivitamins yet, not a bad place to start. All right, now we'll go one for Halloween. Pumpkins, actually pumpkin rinds. What do pumpkin rinds have to do? Well, pumpkin rinds were determined to be the most potent fighters against candida that are out. In fact, so much so that they are looking at manufacturing drugs from pumpkin rinds. Until then, when you think about it, there's a way to incorporate pumpkin rinds into the diet. It will be incredible for fighting things like yeast infection. They said the pumpkin protein could be developed into a natural medicine for fighting these yeast infections in humans. The protein also blocked the development of certain fungi in the body in addition to that, and can be used as a natural fungicide in agriculture. All right, now to one of my heroes all the time, the GAO, the Government Accounting Office. This one seemed to get by the news media just a little bit. What it was the FDA fails to follow up on unproven drugs. I didn't find this article in the health section. I found it in the business section. And there's a reason for that. They're more concerned about the money, ironically, than they are actually at people's health. What the GAO said was, quote unquote, that the FDA in 1992 began speeding up the approval of novel drugs based on so-called, what they called surrogate endpoints, or laboratory measures that suggest the drug will make real improvements in a patient's health, such as HIV drugs and things like that along those lines. Suggest, not proven or shown, just suggest. The reason they favored the program is because it helped get more products to the market sooner without conducting long-term patient studies, which could take years and cost millions of dollars. And on top of that, it's the responsibility of the drug company to do these follow-up studies. But believe it or not, this is what the GAO found out. In 16 years, since the FDA started accelerating the approval of drugs, it has never once called a drug off market due to missing or unimpressive follow-up data. They give a case. Shire Laboratories produced a low blood pressure product called proantimine. The study had gone incomplete for more than 13 years. The GAO found that proantimine has generated more than $257 million in sales, even though the clinical benefit of the drug has never been established. And to make it even more so, let's look at a little more dramatic example. The FDA approved AstraZeneca's lung cancer drug called Iressa in 2003 based on early results showing it reduced the size of tumors. But later studies show the drug did not extend patient lives. In fact, the FDA left the drug on the market despite hundreds of reports of fatal pneumonia developed from taking the medication. The FDA's excuse for this? In certain cases, FDA officials say withdrawing a drug would mean eliminating the only available treatment for a condition. So if I got this right, a little bit of poison is better than no poison according to the Food and Drug Administration. Or what they believe more so in superstition, not science. Insurance companies got a hold of this and stopped rewarding these drug companies by paying for unproven and useless medications. That would save everyone a lot of money. Instead, insurance companies are just to blame as much as the medical companies for funding useless, harmful medications. After that, we go to antidepressants. There's an antidepressant on the market. The chemical name's nortriptyline. It causes increased suicidal thoughts, and yet it's still on the market. There's a good example. In fact, nortriptyline, known as Sensival, Aventil, Pamelor, Nopress, Allergon, or nortriptyline, increases the emergence of suicidal thoughts in people taking this antidepressant 9.8-fold. Not only that, worsening suicidal thoughts in people taking this antidepressant 2.4-fold. Interesting thing to think about when taking an antidepressant to feel better. You might as well grab yourself a lucky rabbit's foot. Now I wanted to spend some time on this one, as we're continuing on the same trend about the failure of the Food and Drug Administration, and actually I blame a lot of the media for just sitting around and doing nothing, including politicians, which really seem to be more concerned about steroid and baseball than actually anybody's health. And this is regards to Gardasil, an HPV vaccine that was almost mandated by the U.S. government and state governments to force children to take. Dr. Diane Harper, who is the lead researcher on the Gardasil vaccine development and Cervarix, which actually, remember the name Dr. Diane Harper. She deserves a lot of credit for coming forward on this. Keep in mind, she was the lead researcher. And this was presented at the 4th International Public Conference on Vaccination, which took place in Reston, Virginia, October 2nd through the 4th. I want you to remember that in case you want to look it up for yourself before you have any of your children vaccinated against this. Dr. Harper began her remarks by explaining that 70% of all HPV infections resolve themselves without treatment within a year. 90% of those infections resolve themselves without treatment after 2 years. After that, the 10% that don't, half may become carcinogenic, which is something to keep in mind. A lot of the audience was kind of shocked by Dr. Harper's statement because they thought that she was there to promote the vaccine. She further came out and said, there has been no efficacy trials in girls under 15 years of age. No efficacy trials. Keep that in mind when the FDA seems to prove things on surrogate endpoints. She also went to say that her employer, Merck, the manufacturer of Gardasil, studied only a small group of girls under 16 who had been vaccinated but did not follow them long enough to conclude sufficient presence of effective HPV antibodies. They never even followed it up before they started injecting children with this vaccine. This is not the first time Dr. Harper revealed that Merck never tested Gardasil for safety in young girls. During a 2007 interview on KBC News, she said giving the vaccines to girls as young as 11 is a great public health experiment. At the time, which was the height of Merck's controversial drive to have the vaccine mandated in schools, who in the world would take a vaccine that's unproven and potentially harmful and force everyone to take it in the right conscience? She said, Dr. Harper said, quote, when asked why she was revealing this information, because, number one, no one will print it, the news media won't announce it, and congressmen and government doesn't seem to care. In fact, they're more for making you take it than actually not taking it. She said, quote unquote, very simply, I want to be able to sleep with myself when I go to bed at night. Since the drug's introduction in 2006, the public has been learning the facts the hard way. To date, 15,037 girls have officially reported side effects of the Gardasil to the Vaccine Adverse Events Reporting. These adverse reactions include Guillain-Barré, lupus, seizures, paralysis, blood clots, brain inflammation, and the CDC finally acknowledged that there have been 44 reported deaths to this vaccine. She also said the rate of serious, people say, well, it may prevent cancer. Well, Dr. Harper also said, quote, the rate of serious adverse events is greater than the rate of cervical cancer itself. Now the question is, what type of punishment or fine or anything should be imposed upon a company which knowingly produces a vaccine with no adequate studies that results in the deaths of 44 girls outside of the serious injury of 15,000 people? And no one seems to really even give a damn. In my mind, I think a company that fabricates a study that allows a drug to go to market without proper testing and harms children should be held accountable for manslaughter. Bottom line, think about this before other vaccine campaigns start going around like the swine flu or flu vaccine, so forth and so forth. And that is how I'd like to conclude this. Thank you.
Thank you very much, Ralph. Something to consider when we're thinking about getting vaccinated. I appreciate your information. Once again, thank you for joining the Fit and Healthy Today show. Research, look things up for yourself. Thank you for joining us. Bye.